Diet for fat and cancer patients. The Royal Wells Academy will explain fat and oil. Cancer patients have concerns about fat intake, and there is controversy over the health effects of fat. Fat can cause symptoms such as stomach pain, and some think fat is related to cancer. However, it has not been reported that fat itself is directly related to cancer. 1. Roles and importance of provinces. Lipids are essential nutrients in the body, which act as follows. The ability to protect and maintain bones and cells, contributing to membrane formation of cells, including cholesterol needed for hormone production. It improves the taste and aroma of food and helps absorb fat-soluble vitamins A, D, E, K. 2. Types of fat and food. Fatty foods include vegetable oils, olive oil, avocado oil, and canola oil. Animal foods, fish, meat, dairy products. 3. Fat content by food. Meat and fish approximately 20% fat contained. Dairy products 50% fat included. Oil 100% fat included. 3. Saturation and unsaturated fatty acids. Differences between saturated and unsaturated fatty acids. Saturated fatty acids are mainly present in solid form, and can increase the risk of cardiovascular disease. Unsaturated fatty acids exist in liquid form, and have a positive effect on health. The intake of saturated fatty acids is recommended to be less than 7% of the total energy. 4. Food selection and nutritional ingredients. Recently, various products such as low-fat milk have been released. The content of saturated fat can be checked through the nutritional ingredient table. For example, if saturated fat is 33%, 1/3 of the recommended daily intake can be considered to have already been consumed. If fatty foods are frequently consumed, it is desirable to replace them with foods with low saturated fat. 5. Ratio of essential fatty acids. Types of essential fatty acids. Omega-3 fatty acids, alpha-linolenic acid. Omega-6 fatty acids, linoleic acid. It is important to eat fat in harmony, rather than unconditionally eating less fat. 6. How to cook and use oil. Depending on the type of vegetable oil, the contents of omega-3 and omega-6 differ. 7. The choice of oil is important depending on the cooking method. Heat-resistant oil, canola oil, avocado oil. Oil that is weak against heat, olive oil. It is important to preserve the structure of fatty acids by using oil appropriately. Coconut oil and olive oil. Coconut oil is not recommended for cancer patients. Coconut oil is high in saturated fat, which can cause indigestion or diarrhea. Olive oil is effective in improving triglycerides and cholesterol, due to its high omega-9 content. It is recommended to use different oils to match the ratios. 8. Recommended intake of nuts. Nuts are rich in vitamins and minerals and are recommended for cancer patients. According to the 2020 Korean Nutrition Intake Standards, it is recommended to consume about 30 grams of nuts per day. Overconsumption of nuts should be avoided, and aflatoxin may be produced depending on storage conditions. Conclusion and summary. Fat is not just a nutrient, but is composed of fatty acids that play various roles. It is important to eat fat correctly through various recipes. Information on how to consume healthy fat will be beneficial for cancer patients. If you enjoyed the video, please subscribe and like it.